Hold up for a second. All right, so you ready? Okay, so you can start now. Okay, so we're doing a lower fixed 3-to-3 or canine to canine retainer. What we've done already is we have the patient isolated. We use a very ultra fine round diamond burr simply to roughen the surface here to get better adhesion during the bonding procedure. All right, so now we're going to apply the etch. And we'll do a traditional 30-second etch. If you're a dentist, you're aware of what that does. If you're a patient seeing this is basically to prepare the enamel so that the bonding material or the glue will adhere to the tooth. And we typically leave that for about 30 seconds. And then we're going to rinse it off really well. So the patient, it does have a sour taste. So we always warn patients before that it's going to taste sour when we're rinsing off. But then we will clear all that material out of the patient's mouth. All right, another 10 seconds or so here. All right, so we'll always use high-speed suction to make sure we catch all the edge coming off the tooth. Okay, and then we use a lot of air to make sure it's really dry. This is really important because if there's any moisture, we're going to get a failure of the bond. It's not going to bond as strongly, and we don't want this breaking when the patient's eating. So a lot of air, and then what we like to do is use a tooth dryer, which has no moisture in it. Right? Looks like a little hair dryer almost. And then we see that nice frosty surface of the enamel. Now the next thing we're going to do is we're going to apply a layer of ashore primer. Now, ashore primer is pretty much the strongest primer that you can get, and this creates the strongest bond of the enamel of the material to the enamel. So that's put down first. Now, the ashore is it's like watery kind of material. It's not very thick or viscous. So we apply this simply for strength because we want that strong bond. And then we're going to apply a more traditional orthodontic primer, which is called, we use light bond primer. And the only reason for this is that it's a little stickier, so a little tacky. And we also coat the wire in that as well. And when we place this in, the idea here is that the primer we're putting down, the light bond, is going to just give us a tacky surface that we can now position the wire properly, and it'll just stick to the tooth before we actually cure it. So this wire a lot of times the wire will just drop in nice and straight. Sometimes you got to put a little details on the wire to make sure it contours to all the lingual surfaces properly. Okay. And this one we contoured right before the video, but you can see how nicely that fits. And we're aiming to be right through the contact points, which is usually the junction of the incisal and middle third of the tooth. All right, so now that we have it in the position we want, we're simply going to light cure it, which this is curing the light bond primer, which is simply holding the wire in the proper position now. So now we can apply our flowable composite. We like to use Flowtain from Reliance. And this is really what's going to hold it in place long term. We want to make sure that we have a fairly thick amount of composite going front to back, or what we call buccal lingually. But we also want to keep it narrow left to right to keep it easily cleansable for the patient. You never want to get any of this in the interproximal or in between the teeth. Almost there. And we put it long, height-wise, incisal gingivally, simply because we increase the bonding surface there, which does increase the bond strength. We have a very low failure percentage on these retainers when they're done with this technique, which is the idea. We don't want to have to fix these. We don't want to have patients having a relapse when they have a bonded retainer. All right, so now we have our layer. We're going to do a final cure. And importantly, after this procedure is done, we always want to show the patient how to use a floss threader. They can also use a water pick to help keep this clean. But floss threading daily underneath the wire and the contact points is obviously extremely important for long-term health of the gingiva or the gums. But the lower anterior teeth are the most unlikely place to get decay. So if hygiene is fairly good, we are confident that the patient can maintain these for a real long time without any kind of issue. And last time through. So we can get one final look at that retainer. You can kind of zoom in there. And that is our lower fixed retainer.